It's difficulty in breathing, shortness of breath, sudden dizziness, not waking up or not interacting, confusion, or severe or persistent vomiting. These signs in adults mean that you should be contacting your physician or the emergency room right away. Now let's take a look at the prevalence of influenza A, or H1N1, in the United States. And when I was visiting with Dr. Lee at his house, I had a very nice discussion with his wife, Leslie, on this particular subject. And specifically, we talked about the prevalence of this disease and just how serious this is in terms of a pandemic. What you'll see on this chart here is that right now, basically 48 out of the 50 U.S. states are reporting widespread influenza A H1N1 virus. And this is as of October 31, 2009. When you look at the numbers here, and Leslie, this is what I was referring to when we spoke, the number of people as of the middle of October in the United States who have been infected with the H1N1 virus is actually fairly large. It's about 22 million people. And if you look at the number of those people who have been hospitalized as a result of H1N1, you're looking at about 98,000 people that have been hospitalized. If you look at how many people have died through the middle of October, it's approximately 3,900 people who have died. Now, I'm not trying to minimize the fact that people have died from this virus, but I think it's very important to consider that in a typical year, in an average year, the regular flu, the regular seasonal flu, will claim 36,000 lives. So, in fact, I would argue that when you look at the trend, the statistical trend for the first 12 months of this influenza A H1N1 pandemic, this is actually a milder flu when compared to the regular seasonal flu. So, I'm not saying that people shouldn't be worried about it. I am not saying that you should just ignore this virus, but I am saying that when you see it in the media, when you see it on the internet, when you see it in the newspaper, when you see it on television, just keep in mind that the numbers are actually far lower than for the regular flu. The other interesting chart I wanted to show you is that it's very interesting that this particular influenza is affecting primarily people who are 18 to 64 years old. So, of the 22 million people who have been infected by H1N1, more than half of them are between the ages of 18 and 64 years of age. The next largest group would be those who are 0 to 17 years of age. It's about 36%. And interestingly, the older population seems to be least affected. It's about 9% of the cases are reported in people who are 65 years of age and older. In terms of protecting yourself, I don't think I'm telling you anything that you don't already know on this slide here, but it's the basics. Consider getting flu vaccines. Wash your hands frequently. Our children, Alyssa and Andrew, they're so tired of hearing us say wash your hands and wash them well and use soap. Sometimes our son Andrew will kind of get the hands wet but skip the soap part. Don't touch your eyes, don't touch your nose, don't touch your mouth. Don't share drinking glasses, utensils, or food. Minimize your contact with sick people. Eat properly. Get ample sleep. And again, I know you're getting tired of seeing this, but consult with your physician regarding your specific health conditions. Let me talk a little bit about vaccines, because there are a lot of questions about vaccines. There are basically two different vaccines that people are thinking about getting this flu season. Typically, the flu season runs from October through April of the following year. This year, the US government has ordered 250 million doses of H1N1 vaccine, and they're being made by 4 different companies. There are 2 different types of this vaccine. One is a needle delivery that you see here, and the other one is a nasal delivery where they actually just mist this into the nose. The most important thing that you have to remember is that getting vaccinated by the H1N1 vaccine does not protect you from the regular flu. So if your physician recommends that you get both vaccines, meaning regular flu and also the H1N1 vaccine, just remember you have to wait 1 month. So you can get vaccine number 1, then you have to wait 1 month, and then you can get vaccine number 2. Now, how about protecting others? We've talked about protecting you, but how about the people around you? Well, again, this is basic common sense. Stay at home if you are sick. It's very interesting. I was talking to the principal in our town's middle school, Milburn Middle School, and he was telling me that he is so frustrated that the parents are sending kids in and they're vomiting, there's coughing, they're sneezing, and some of them, they arrive in school and they're going right back home after 45 minutes. So his point was, and I agree with him, that you have to stay at home if you're sick, because if you go to work or if you go to school and you're very sick, you're going to wind up making a lot of other people sick. Cough into your elbow. There's a picture right here of somebody doing that. Minimize your contact with other people until 24 hours after your fever has resolved. And again, consult with your physician. So, in terms of summary, and there'll be a time for the question and answer session as Leslie pointed out, the key summary here is that 2009 has been the media year for the H1N1 virus. I hope that I've been able to show you some common sense steps that you can take to protect yourself, your family, and others from this virus. Inoculation or vaccination with the H1N1 vaccine and the seasonal flu vaccine may be appropriate for you. You should check with your physician on that. And probably the last thing, and I think one of the most important things I'd like to leave you with, is just take all of this media scrutiny with a certain grain, a little grain of salt here, that the media is looking to blow the story up into something much bigger. So I thought this cartoon was very appropriate for what I think the media has done with the H1N1 swine flu. Thank you very much.